Time-lapse live microscopy provides an opportunity to observe the dynamics of human embryo development in vitro for up to 7 days to the hatched blastocyst stage. We mounted a temperature and CO2-controlled incubator chamber on an inverted microscope, and images of embryos were captured every 3 minutes using a digital imaging system. Initial studies confirm that development of mouse embryos is as successful in this system as under standard laboratory incubator conditions. Human frozen-thawed pronucleate oocytes donated for research were cultured in sequential medium that was changed every 2 days. 2 frozen-thawed pronucleate oocytes are in view, showing cytoplasmic streaming and organelle movement, especially the nucleoli. As syngamy approaches, the pronuclei disappear, and a cleavage plane forms parallel to the pronuclear axis. The 2 daughter cells are at first irregular in shape during completion of the first mitotic division. Cytoplasmic fragments form primarily at this stage, some of them becoming reincorporated, but others may persist. On the second day, the second cleavage forms the 4-cell stage. One blastomere may divide before another, and an uneven number of cells often occurs during this transition. Embryos remain at the 4-cell stage for approximately 15 to 18 hours. One notes that neither embryo is quiescent during this period, both demonstrating active, vital cytoplasmic movement in advance of the upcoming and rather significant third cleavage. Between the second and third days in culture, the embryos divide again to form 8 cells, but no additional fragments are generated. The blastomeres appear to move and pulsate within the zona pellucida until the time of compaction. At this point, the embryo on the left simply continues to increase in overall cell number. In contrast, the embryo on the right appears to be losing cell definition in preparation for the first stages of morulation. Here, blastomeres begin to develop adherence between one another, demonstrating ever tighter cell-cell junctions. Nevertheless, the resulting morula that is formed at first appears irregular, rolling freely within a framework of disassociated fragments. Compaction occurs at the 8-cell stage as a result of adhesion between the membranes of adjacent cells. The embryos no longer possess defined blastomeres, and static observations can lead to the false impression that they are abnormal. Embryos start to cavitate on the 4th day when more than 16 cells are present. Pools of blastocelic fluid accumulate near the center of the embryo as a result of sodium-potassium ATPase activity in the polarized outer cells. The pools eventually coalesce into a single blastocelic space, and the embryo can now be called a blastocyst. The left embryo is developing faster than the one on the right. The inner cell mass can be seen moving within the embryo and creating a clump of cells, the inner cell mass, at one pole. On day 5, the blastocele of the left embryo now expands rapidly, and the zona pellucida is stretched thin but never to the breaking point. It then rapidly collapses and re-expands. The left embryo undergoes 3 cycles of expansion before hatching on day 6. It emerges through the weakest point in the zona pellucida, in this case, about 11 o'clock, and most often occurs close to the inner cell mass. After hatching, cytoplasmic fragments remain attached to the discarded zona. Clearly, they do not participate in embryo development. The blastocele of the hatched embryo expands enormously, and the trophectoderm cells continue to divide. After hatching, the inner cell mass also enlarges and forms a dense pole on one side of the floating blastocyst on day 7. Time-lapse observations in vitro can revolutionize our appreciation of the dynamics of the first 7 days of human development. They reveal the precise timing of cell divisions and morphogenetic events, such as cytoplasmic fragment formation, compaction, and blastocyst growth and hatching. Using time-lapse technology, we are afforded a great opportunity to witness the beginning of human life.